I think having mechanism to increase access to data across Europe would make a big difference, would allow us to build AI tools that are more powerful.
I think we have to involve patients with an app, through their mobile phone. We have to be more proactive and make them protagonists of their own problem.
I also have a lot of hope for the digital technologies like digital pathology and big data, and especially artificial intelligence, that should absorb some of the cost in human labor and human effort for a lot of the work that goes into taking care of a cancer patient.
One of the initiatives for me that has a big focus is early detection. We have to close the gap between the high-income countries and the low and middle-income countries. You can see that in the low and middle-income countries, the people just get detected with cancer way too late stage. That means they die. So if you get the early detection going into the low and middle-income countries, people will get the diagnosis sooner, so they can be treated. Because in stage 1 and 2, you can be treated.
Helping our patients to get the innovations in the system, we need to start with investment in education. Education, not only medical doctors and nurses, other healthcare providers, but also educating the society. Without prevention of cancers, of other diseases, and input in schools really early with the children, we cannot think about having more resources for new technologies.
And I think in order to address this problem of unequal access to education, the only way is to involve patients. And to involve patients as equal partners in decision-making in all levels. For that, what is needed is education, patient education. And then we need to have patients in all tables when we are designing, for instance, clinical trials, when we are discussing the value of the results of the clinical trials, and ultimately when decisions are being made about the access to the innovation that comes out of these clinical trials. But also patients need to be on board when decisions are being made about the delivery of this innovation and the prioritization of the delivery of this innovation.
But bringing together all the patients together in one group, in one voice, I think has much more impact than different individual association. It doesn't mean that to reach out to a specific disease, to a specific group, you do need to have a dedicated patient advocacy group, but there also needs to be an enormous group coalition, because the goals, the work, the guidelines, the recommendations, the success stories, the identification of gaps are the same for everyone. And once again, patients do say that they find that a lot of work and good ideas are wasted because they are not brought together. So a coalition is a good solution.
But also join forces between science, between doctors, between industry and patient advocates. And I think that the global patient advocates should make it their problem. It is their problem, and as long as we do not make it a problem of patients, we won't solve it. So cooperation between patients, patient advocates, physicians, research and industry for the global patient.
The patient is a center of the universe in the whole ecosystem in oncology. Again, there is a definite need for a universal organization that puts together everything in context with the patient in the center of everything. So the International Cancer Patient Coalition seeks to address that.